Hi, I'm Christine Lee. I'm a gastroenterologist at Cleveland Clinic. I'm the director of endoscopy at Cleveland Clinic Willoughby Hills Ambulatory Surgical Center. What are gallstones? Gallstones are precipitants or hardened pieces of bile that accumulate and form into sand-like or stone-like structures. Bile is a bodily fluid that your body makes that is produced in the liver, and it aids in digestion. So in particular, it helps emulsify fats, proteins, and the foods that you eat so that it can be digested and absorbed into your body. What is the gallbladder? The gallbladder is an organ tucked away under your liver that acts as a storage space for bile to pool and be held at a convenient time, like after eating. So that's where you need most of the bile. What are the symptoms of gallstones? How they present or what the symptoms they produce can vary from people to people. They can have none of those symptoms or they can have all of those symptoms. But generally, the most typical symptoms that one experiences or we speak of is the right upper quadrant pain that may radiate to the back, shoulder, or chest, nausea, vomiting, fevers, or just feeling not well. A typical time that the gallstone symptoms present is about 15 to 20 minutes after eating, particularly if it's a fatty, greasy, larger meal. And they can last anywhere between 30 minutes to 1 to 2 hours post-meal. What are the treatments for gallstones? Keep in mind, statistically speaking, most gallstones remain asymptomatic, meaning non-problematic. Now, that being said, if you are in that percentage that it is problematic or symptomatic and you need the surgery, then the right thing to do is have that surgically removed, what we call cholecystectomy. Cholecystectomy is when your gallbladder with the gallstones in it is surgically removed. They can be done laparoscopically or open. Majority of the gallbladder surgeries that occur in the U.S. is done laparoscopically, where the surgeon goes in and takes the whole gallbladder out. So most patients tolerate the surgery very well. In some instances, they can actually be done as an outpatient and you go home in the same day. As far as recovering from it, that varies from people to people. If you're more athletic, healthier, obviously you'll bounce back much, much quicker. And if you have other comorbidities, then you might take a little bit longer to recuperate from that surgery. You can live well without a gallbladder. Gallbladder, thankfully, is not an organ that's necessary for life. That being said, your body just has to relearn how to reabsorb and kind of redistribute the bile since they don't have the gallbladder container itself. I mean, you want to be kind to your body. Give your body that space for that learning curve where your body now has to learn to adjust to the continuous circulation of the bile. So you want to avoid large boluses of fatty, greasy, buttery meals. And should you experience post-cholecystectomy diarrhea, you want to really talk to your provider about it, because if you fall into that few percentage where you do have that bile-induced diarrhea that doesn't resolve over time, you may need a prescription medication, what we call bile-binding medications, to help you with that diarrhea so you're not suffering needlessly.